still on. And they have stolen about five catalytic converters from us, stolen from our vans twice, our truck, and a bus. And I'm just so happy. I hope it leads us to all the others who have been there. But I'm so glad because they've been doing this for years. And it's just been horrible. And I'm so happy. I just saw that and I wanted to jump for joy. So thank y'all. Hey, Brady.
That is good news. Um, and Morgan, do you know if we have quorum yet? I can't remember what the number is.
The number is 8, so it looks like we do.
All right, perfect. So
Wait,
it started.
we?
Is that
No.
8?
No, we need one more person because
Okay.
Brandon and Lauren aren't, and I'm not.
Okay, so one more.
Mhm.
Well, I get, we don't really have anything we're going to vote on today except the approval of the minutes, right? So, I don't know.
We can come back to that if you guys want to. We can just skip over it for the vote and then come back just to get started. Is that good with everybody?
Yeah.
All right, so we're going to go ahead and call the meeting to order. This is the June 2nd meeting of the Indian HIV Epidemic Advisory Council. I am your co-chair, Deanne Bullock, along with Claire Bolt. We are going to skip over our next action item, which is actually approval of the minutes until we have quorum. So I'm going to hand it over to Morgan to give some updates on the EHE work groups and the upcoming Fast Track City events.
Thank you, Dr. Bullock. Hey, everyone. So updates are brief today. Neither the U equals U work group or the prevention work group met last month. I was out of the country for family things. And I think Brady was traveling too. And then our other work group chair had some scheduling issues. So no real updates there, except for the U equals U group. We are still working on the campaign, the U equals U campaign ambassador project. And right now we really need help with recruiting ambassadors, folks who are persons living with HIV/AIDS. So I will be sending you all the nomination form again, as long as along with a template that you can send to folks to ask them to apply. So yeah, we're in June now. I really want to get this campaign, off the ground soon. So yeah, we could use your help with that. And then for Fast Track Cities, I sent you all the invitation, the official invitation for the signing ceremony that's happening this Friday, as well as the implementation workshop that's happening the following Monday. So very glad that that's happening. It's been a lot of work planning. I think a good number of you are going to be speaking at the ceremony. It's a short ceremony from 1 to 2, and it's happening at the Public Health Department if you want to attend. And yeah, and I think Dr. Brown had some updates that she wanted to share as well.
Real quick, Morgan, are we recording?
Yes.
Okay.
Thank you. Do you mind if I share my screen? I put together a short PowerPoint for you all.
Okay. You should be able to in.
Thank you. Okay, so I wanted to provide a quick update on, I guess, kind of two things, mostly the trauma-informed care and cultural humility subcommittee. Um, that's a subcommittee of the equity work group, but also an update on the equity work group as our center, the Center for the Study of Social Determinants of Health at Meharry, became the convener as of a few months ago. So I wanted to provide a quick update on that as well. So briefly, I'm just going to go over a reminder of what the trauma-informed care description project, the project description was or is, and give some progress updates, some examples of just to kind of explain what our aims will look, what they looked like originally and what they will look like ultimately, and then what our next steps are. So the overarching goal has been to collect pre-implementation data so that we can inform a metro-wide implementation of culturally responsive trauma-informed HIV care throughout Nashville. And this has been, at this point, funded by the Tennessee CFAR Developmental Corps Award, which is with the NIAID. It's a P30, and it's a one-year project to just really lay the foundation to prepare us for implementation. And so at this point, this particular project has been its three aims. And the first aim was to meet with 5 of the largest HIV care providers as institutions and to create process maps of each of those institutions to really understand their standard of care. And now we're working to synthesize that so that we create one metro-wide process map so that we can develop recommendations out of it as to how to implement, kind of where to start in our implementation. And then for AIM 2, we interviewed 36 personnel across 5 separate institutions, the same institutions as in AIM 1. And we're currently analyzing that data. We have 2 research assistants, plus myself, plus working with Dr. Barroso at Vanderbilt University School of Nursing. And we're using the Consolidated Framework for Implementation Research to analyze barriers and facilitators of implementation throughout Metro Nashville. And then finally, AIM 3 is to conduct cognitive interviews with 20 people living with HIV so that we can validate a new instrument that the equity work group overall has been helping revise, as well as my voice at Nashville Cares and Meharry Wellness Center. And so this is just a quick example of what a process map looks like relative to trauma-informed care. This is actually not one in Metro Nashville. I just didn't want to show those yet because they're still being created. But this is what one looks like that I recently created for a different HIV institution. But generally speaking, it's just, what services are currently offered and then engaging stakeholders to really understand where we might be able to start implementing change to increase alignment with trauma resilience. And then whenever we get to the stage of having our results, using the Consolidated Framework for Implementation Research to create themes based on our interviews, we will share that internally and also externally as a peer-reviewed publication. And this is just an example of another project where we did basically the exact same thing with Emory. And we generally used a similar interview guide, but we did update it, probably about 50% of it, specifically to be culturally responsive, which I think is innovative and is something that as a city will be innovative for us. And then finally, this is an example of what the instrument that I mentioned, it's so historically, we developed something called organizational trauma resilience assessment, and that is to be used with personnel of institutions to measure alignment with organizational trauma resilience. And this instrument, through the work groups I mentioned previously, we have changed those, updated those items so that they are now patient-facing, so that we can use them jointly to measure organizational trauma resilience from both a patient perspective as a patient-reported experience measure and also from organizational personnel perspective. And we also created a new subscale as part of that called cultural responsiveness. And there are 6 subscales total within the overall scale, and they can each be used separately. So that also is, I think, a nice contribution because such a scale didn't exist previously for this purpose. And so we are currently in the process, starting Monday, I believe, of doing these cognitive interviews at Meharry Wellness Center. And after that, we will then be launching, skipping down to the bottom here, we'll be launching not a nationwide study, but a regional study in the southern US with some comparison sites on the coast with about a 1,200 person data set. We'll be interviewing about 1,200 people living with HIV to help validate this assessment. And we will, just skipping forward ahead, again, we will be recruiting here in Nashville. So I think this will be a very nice kind of interim next step for our work. A little bit of implementation, really just trying to assess prevalence of trauma and resilience in our institutions in the South, but particularly relevant to us in Metro Nashville. So we will be reaching out soon to hopefully recruit from CCC, CARES, StreetWorks, Meharry Wellness, anywhere else that you all can think of that has folks living with HIV as their primary patient population. Jumping back really quick, other projects that are building momentum. We have a paper coming out that's between CARES and CCC on the impact of a trauma resilience intervention. And that shows that it increased viral suppression and retention and care. And we also have some revisions to how we're measuring trauma events that's coming out from Nashville CARES data. And we've been working with Tennessee CFAR Biostatistics core to work on some data relative to personnel experiences. And then finally, a resilience-focused HIV care program out of my house clinic. And so together, all of these, I think, are really going to nicely inform the next steps, which are to work on implementation. And really what we plan to do is create somewhat of a coordinating center at Meharry, Center for the Study of Social Determinants of Health, where I'm the director of HIV and trauma studies. And probably our biggest next step is in August, we're going to host a retreat. And I would hope that actually probably at least half the folks on this call have been involved in some capacity with this project. And so my hope is that we can find a time where we can spend, in a dream world, 1 to 2 days together, where we can pay for everything to kind of shower you all, where we can also put our heads together and talk about recommendations for next steps. And really the best move for funding this work, if it's PCORI, if it's NIH, or what that might look like. So I think that is all I have. Any feedback or questions about this project or anything that I mentioned?
I don't have a question, but Lauren, you've done such an amazing job on this project, and
Thank you.
really
We
going
have
after-
done such an amazing job. This has been truly a community effort.
Yes, but you especially have done a ton of work on, finding funding and going after it, and there's so many irons in the fire right now that even though I'm part of the work group, I didn't even really realize until you showed all those slides. So thank you so much for your hard work on this.
Yeah, thank you so much for your support, and lots of folks on this call for your support. I'm excited. This is a total passion project.
Anyone else have questions or thoughts to share? No?
Would you be able to send that presentation to me so I can share it with council members?
Yes, absolutely. Thank
All
you for
right.
having me.
Yeah, thank you. We'll let you get on with your day.
Okay. Bye, everyone.
Thank you.
Thanks.
So I think I'm up next to talk about our website development. So if you'll recall from our last meeting, we discussed having a space for EHE Nashville initiatives on the In the Syndemic Tennessee website, which is a statewide focus, but they were kind enough to offer us free space on their website for some of our stuff. So I've been putting together sort of an outline of what I think we would want to include on that portion of the website. And I also went back and looked at the original EHE plan and realized there's actually a lot of pretty specific guidance in there about what should be included on the EHE website that I had completely forgotten about. So I think that for right now, so that we can go ahead and get something up online. And anyway, I've put together an outline that I'll be sharing with Morgan and Dr. Bullock soon for their feedback, and then we'll probably just go ahead and get it posted as soon as we can, and we'll share it with all of you when that's up and ready to go, and you can offer any feedback that you have. But I think that eventually we are probably going to want to get our own website, and we can talk more about that later. But as I've been working on this, that has really sort of become clear to me. So we'll talk about that more in a few minutes, but that is my update for the website.
Thanks, Claire. Since we do have form now, we'll bounce back to our approval of the minutes for the April 7th meeting. We sent the meeting minutes out on April 21st, and I hope everybody's had the opportunity to review them. If you haven't, please take a quick minute and review those. And also, if there are any amendments or changes that need to happen, please present those now. Otherwise, I'll take a motion for approval.
Motion to approve.
A second, please.
Second. Sorry, I'm late.
Welcome. All in favor? Morgan, did you grab all those?
Okay. Is that 5? It's 8, right? We got it.
Okay. All right. Thank you. We're also going to next jump to the advisory council nominations. From our last meeting, we've received at this point 3 advisory council nominations. And many of those are people and persons living with HIV and AIDS. So those nominees are going to be sent out after this meeting. Morgan's going to send out their applications as well as a survey link for us to vote on the applicants. Our current ones, 4 was originally 4. We currently have 3. Is Nicholas Calvin, Dr. Taye Link, and Dr. Lauren Brown. Those are the 3. So shortly after this meeting, Morgan will go ahead and send out those links and those applications for you to review. Any questions on the advisory council nominations before I turn it back over to Claire to talk a little bit about the EHE work groups? Yeah. All right.
Was that a question?
Dr. Bullock, is it too late for me to submit a name? I would like someone from my staff to be, just to make sure that we always have someone present if I happen to be away. Is that possible?
I think we can go ahead and accept the nomination. Morgan, would we be able to send them out in the group, or would we need to wait till the next meeting?
Would you be able to have that person fill out a nomination form soon and send that to me today? If not, then
Yes. Can you send it? Can you send the form to me again, please? And send it to my StreetWorks account as opposed to the council instead of Nashville.gov. Or
Send
do
it.
you,
Can you say that one more time?
I was gonna ask if you can send it to my StreetWorks account as opposed to Nashville.gov.
Sure.
Thank you.
Any additional questions? Go ahead, Claire.
All right. So this is really kind of one of the last things we'll discuss today. It's probably going to be a pretty short meeting, but this is something we haven't really talked about in a pretty long time, kind of since the formation of the advisory council. So I think it's important to think about whether we would like to form any new work groups. So right now we have the PrEP work group, U equals U, trauma informed care, and the equity work group. And these 4 work groups represent really a very small portion of the EHE plan. So I think the time is ripe to start thinking about other work groups that we should be developing. And I have some thoughts based on what I was looking at earlier today when I was looking over the original EHE plan. But before I get to any of that, I wanted to just pose a question to the group of sort of what are specific issues that council members are seeing right now in Nashville that a dedicated group of stakeholders could work towards addressing? And are there natural places for a work group to form right now?
Claire, that's a good question. And I'm not going to answer it directly, but you mentioned something I think that will be helpful to me in thinking is to go back and review the plan. I think I did that a long time ago. So to go and review the plan, I think that would help me to be able to answer that question.
And for me, being a council member, Claire, I don't necessarily see a specific place. It would really have to be something more focused because we have so much coming at us all the time that unless you have a specific interest or passion for it, I don't think people will actually dedicate their time to it unless it's forced upon them, so to speak. And so if you were to work directly with Aaron Evans, who's now chair of health, the only thing is that that person changes yearly. So it's almost like getting somebody in that's got to get acclimated to what's going on, and then the council has to reacclimate them to a new person. So I'm really not sure. And then of course next year you're gonna have a new set of council members, at least, you know, several of them in new places that because some of us will be rolling off.
Yeah, I think what you said about it, it has to be something that people really care about already, is very true. And a lot of the way that the current work groups we have, I think, were formed was because there was a person who really wanted to work on this, and they said, I'm going to lead a work group about this issue. So that's certainly a challenge. I know we're also stretched thin, so that's definitely something we have to figure out in forming any new work groups. Meredith, do you have your hand up?
Yeah, I think Brady did first. So Brady, you go first.
Go ahead, Meredith.
Oh, all right, fine. I was just gonna add, I mean, I totally agree, like, that it's gonna take, you know, someone sort of spearheading it and being willing to form a work group. But I also wonder if we want to take a little bit of time to review the latest data, given that, you know, it's been a few years since the plan was released. And, you know, I imagine things aren't going to be like extremely different, but at the same time, it could point us to maybe where some of the gaps are that we really need to be addressing, to like hone in on, you know, what we're seeing. Like if we're looking at, you know, some new trends that are specific to a priority population that are concerning, like maybe it can be kind of a special focus there, but maybe that also tries to sort of help equity. Or looking at the care continuum, are there areas where we're kind of falling short, and do we want to have a special project look there? You know, just as like a couple of examples, thinking about how we can maybe leverage some of the information that the data may highlight to like point us in some direction. So.
Yeah, that's an excellent point. I actually was looking at the HIV surveillance dashboard before this meeting because I had the same thought. And I didn't do a super deep dive, but the issue I was coming up against was a lot of it wasn't necessarily broken out by county. So it was hard for me to see, like I saw that there was an uptick in vertical transmission, but I couldn't tell whether that was in Davidson County or if that was rural areas or, you know, somewhere else. So I think that'd be a great idea. And I honestly, Meredith, you're the person I would ask to do that. So I wonder
Yeah.
if we could talk about for our next council meeting.
Definitely. Yep.
Awesome.
Yeah, I'd be happy to help kind of drill in and like kind of facilitate some of that conversation if that's of interest to the group.
Yeah, I would certainly be interested in that. Brady?
Yeah, I was just going to suggest a possibly an HIV and aging work group. Especially it's something that as I'm quickly approaching 50, and as I hear in the community, there is a lot of talk within that aging community about what they're going to do about housing. This is they have no family, who's going to look after them, what happens, you know, when Social Security doesn't cover everything that they need. So possibly a work group to focus on those needs to address them as they arise.
That's a great idea, Brady. Occurred to me. Dr. Honkai, did you have your hand up too?
Yeah. So I think I had some of the same thoughts as Meredith about thinking about where the data are pointing, but also probably the two ends of the spectrum. I was thought about aging because clinically we do hear there are a lot of considerations there too, and I think Brady also mentioned you know, some of the more social concerns for that age group, but also I work a lot in the adolescent and young adult space. I do think that, I don't know, I mean, if priorities may change from year to year depending on what surveillance looks like, but I'm thinking about also are the categories made broadly enough so that they could be subsumed, you know, as special focus areas change. But I think, you know, thinking about adolescent and young adult voices and engagement is something that I didn't see kind of prominently there, although they could fit in different places. I think one, and for a number of reasons, care continuum outcomes, transitions of care, and also some of the legal questions when we think about PrEP and PrEP availability. So I think there are a number of different questions that impact that population that, you know, this group of stakeholders may be able to intervene on. So I thought both about aging and about adolescents and young adults in that context.
So are you envisioning a group that of I guess that could go two different ways. Are you thinking more of a group of stakeholders that have a special interest in young adults and adolescents? Or are you thinking a work group that's really actually composed of young people? And I mean, I guess it could be a combination of the two, but.
I mean, I think it would be a combination. I mean, I think it's probably important to have, you know, if we have if as part of engagement, having young voices represented on this group in a wider sense. So whether that's as part of a specific working group or overall, but I think there are some unique questions and challenges that impact that population specifically. So, I think it could happen in a number of ways, but it's um, just one that I thought of. I mean, it could be questions about equity for young people. So it could fall within an equity group and be a subgroup within that, or not necessarily, but.
Yeah, that's a great idea as well. Other suggestions for work groups or even just specific areas of focus that we haven't really dealt with so far in EHE? Dr. Hildreth?
Thank you, Claire. One suggestion I'd like to put on the table is to ask the question whether or not the lessons we've learned from dealing with COVID-19 for the last 2.5 years, in terms of the public acceptance and awareness of testing and antivirals and things like that, should we rethink or at least reconsider some of the approaches we've been thinking about taking? Some may need to be altered a bit, or others may, I don't know, be opportunities that weren't before. I just think that the COVID-19 pandemic has opened a door that may not be open for long in terms of the public awareness and acceptance of some things that are related to public health. And I don't profess to know what it will look like. I just have a feeling that we have an opportunity that's been presented by the widespread awareness of infectious disease, viruses, testing, and all those kinds of things. So I'm just putting that out there, something to think about. Is there something we can leverage here that take advantage of due to the response to the pandemic? And it's something we talked about in the President's Health Equity Task Force, that there's an appetite and awareness now in this country for medicine, health, and related matters that hasn't been true for quite a long time. So how can we leverage that to best advantage for HIV? Just something to think about.
Thank you. Yeah, I was actually thinking just the other day about how we're all used to doing our own COVID tests now. I'm sure everyone in this group has tested themselves for COVID at home at least one time. And I was just thinking, wouldn't it be great if everyone also had, HIV tests at home that they were prepared to take whenever they felt like it was necessary, and they were comfortable with that and knew what to do if they got a positive test and things like that. So I think that's a great point. Anyone else?
Claire, I just want to add, I think that what Dr. Hildreth is suggesting is a really good point. We've not really seen much of a difference in our testing numbers, but I don't think that we've actually asserted ourselves in the fact of using the platform of COVID and the awareness that people have right now. And perhaps if we were to send that message and put it out there, we very well may find there to be more acceptance. I think it's just been an oversight. I think that's a great point.
I would echo that from, the work that we, Streetworks and Vanderbilt were doing together in the barbershops. That came out in the conversation over and over again. Like, everyone can pick up a COVID test. Why can't I just pick up an HIV test and do that? Or can we just talk to people about how easy it is to do that? So I think that that's an excellent point. And I think probably, and they also echoed your other point, Dr. Hildreth, about, well, now, people know what like comorbidities are, people know what risk factors are. And these were the conversations that we were hearing from barbers who, I don't know what their HIV status was, but they were making all of these connections and saying like, why aren't we making these connections with them? So.
But I think it's interesting, Dr. A, too, that they are lay people. They're not the healthcare professionals, but they were still able to recognize that that is something that could be very useful in terms of us spreading it and educating others.
That's definitely.
So, and this conversation is making me think about one suggestion that I had after looking over the plan again. And I do recommend taking another look at the EHE plan. I can link it in the chat. It's long, but has a lot of really great stuff in there. Some things that I look at and I think, I don't know if we're ever gonna be able to do that, but certainly some things that are very achievable as well. So one thing that I was thinking about was we haven't really done a lot focused on HIV testing, and that's already come up a few times in the conversation here today. So the EHE plan specifically aims to make testing routine across healthcare providers throughout Nashville, make it easily accessible, and increase acceptability of HIV testing, which I think we're drilling down on a little bit, and talking about how people have a little bit higher health literacy now after 2 years of hearing about COVID, and might be more open to HIV testing than they were previously. So I do think it might be worthwhile to form a work group that is focused on HIV testing and increasing it, especially because I know that HIV testing decreased during the pandemic, but I don't think we necessarily know whether transmission rates decreased. I think it's probably unlikely that they decreased, but what was that? I think I might have cut you off.
It was me, Claire. I was trying, but I didn't see my hand up, raised hand emoji. But now, as you were talking and I was thinking, because during COVID, of course, we weren't able to get close to people, so we saw our testing go down. I'm wondering if people were testing, because in our Latinx community, because we have been doing more work in that, we've seen more positives come out. And that's having a professional with them. If we gave them individual tests, would they seek assistance and care, or would they try to hide the fact that they tested positive? That that to me would be the risk in giving people the opportunity to have the home test, or something to that effect. It was just something that I was thinking as you were speaking. I see Brady hand is up. He probably can speak to that as well.
Well, I was just going to bring up that, there's some intersectionality in some of our current work groups when it comes to testing. I know that working with Prevention Access Campaign through the Positive Peer 2 study, there's empirical evidence and data now that shows that just increased awareness of U equals U and the existence of the science that if you do test positive, that you can still have a normal sex life and still have children and still have a family in those communities in which that was the focus. there was increased testing as a result of that knowledge. So there's can be some intersectionality between the work groups and trying to also promote more testing in the community.
Dr. Shawkai, did you want to add something?
Yes, I would say that, as we empower the community to get tested and request testing, we also still have to have some focus on the providers. I think for us, it's easy to always remember to offer an HIV test to our patients, but there are quite a number of providers who still, that's not one of the possible diagnoses that's on their mind, and it should be, so I think we'll also, our peers will have to have some focus on them, so.
Any other thoughts on HIV testing or what an HIV testing work group might be charged with? I think we've hit on a lot of plenty for them to get started with, but and I think what I'll probably try to do is once we wrap things up today, we have a lot of suggestions for work groups already. And I think we will need to begin thinking about how we recruit people both to lead and participate in those work groups. So we will be asking all of you to provide any referrals for people think would be a good fit for each of those work groups and sort of well-placed. So that's just an aside. Be thinking about that as we're about this, because we'll be asking you. Another thing that came up frequently in the EHE plan was community health workers. And I know that some various groups in Nashville are already working with community health workers in some capacity. After talked a little bit about the Barber program. Is that something we should form a work group around? Some things are happening at an individual organizational level. So I'm curious whether people think that's something a work group would be helpful on.
I think it also does fall within, two things that we've already brought up, like Dr. Hildreth's idea about thinking about the lessons learned from COVID, because of course this is a lesson we, kind of amplified over and over again, but also it, for me, is also falls under kind of this equity focused solutions approach, and there it's community health workers and then some potentially. So I don't know what structure makes the most sense, but I don't know if it has to stand alone, but there are other ways of envisioning it.
And maybe that is something we task the equity work group with thinking more about, because I'm not sure, actually don't really know what they're working on right now. I'm sure Morgan does. Dr. Did you have your hand up, or was it still up from the last time you, I think you may have just, okay.
I didn't have my hand up, sorry, I meant to put my hand down, but I do. I guess one thing about the CHWs would be how would they work with the current peer navigators that are in the clinics. So that would be something to think about. There could be an extension of them.
Great. And one other thing that, linkage to care, two other things that came up quite a bit. Linkage to care came up a lot in the plan. I think that after hearing what Meredith said about taking another look at the data, I wonder if that is something we've already done some work to improve citywide. I have a feeling that our linkage rates might be better now than they were when the plan was developed, but maybe I'm wrong about that. I don't, Meredith, do you know off the top of your head if, yeah, you probably don't for Davidson County at least.
Well, it's a timely question. Our EPI that leads our continuum of care analysis just finished the preliminary kind of look at it statewide, and we do drill into TGAs and metro areas. So like it just like, you know, it's like sitting in my inbox from like 3 days ago. So I can answer that once I get a chance to look, and so maybe that's something I can share with this group. So.
Awesome. Okay, so we'll wait on that because we may find that that's not a big priority anymore. But one other thing I did want to mention, because it came up repeatedly and it's kind of a tricky one, is advocacy. So there were multiple calls for sort of specific policy advocacy in the plan. And so some examples are for comprehensive sex education in schools and even specific curriculums that could or should be used, decriminalization of HIV, Medicaid expansion. And I know there are already groups doing all of this work, but is it helpful to add EHE as a sort of collective into the mix and develop an advocacy work group that that does some of that work? I don't really know where I stand on the issue, but I'm really curious to hear what you all think.
Honestly, I understand, and as you know, being around when we wrote the plan, I understand why we put it in there. But now that it's like boots to the ground, we are all so stretched so thin. I don't know who would lead that. I don't know how that would even look. Like you said, I don't know if there are other advocacy groups working on some of those issues. So we would be kind of working over one another. Would have to develop some kind of communication across the board. It's a big task. And I don't know at this time if it's really something that we have the bandwidth to move forward. But I would hate to just completely throw it away. I just looking at it in a realistic lens. I just don't know if it's feasible for us right now to take that on.
And I think I agree with Brady. I mean, there's just so much there, and I feel like we would just be grasping at very small pieces of it. I think if there's a piece of advocacy that maybe we would want to focus on, one or two pieces, maybe we could tuck those under one of the other work groups where they fit more appropriately and be a little bit more proactive or a little bit more intentional about how we would want to address, maybe one or two, possibly three of those versus trying to grab at everything and not be successful at any of them.
Yeah, I'm really glad that you said that, Brady, because I was thinking the same thing. And I do think maybe we can do a better job of connecting with groups that are already doing work and promoting what they're doing in our newsletter, and letting people know ways that they can get involved if they want to. But yeah, I think having a work group might be more than we can take on right now. All right, great. So that's one we don't have to do. And I think that was all that really came up when I was reviewing the plan, but definitely recommend taking a look back at that if you have a few minutes to kind of scan through There's a lot of great stuff in the plan, and I didn't actually get through the whole thing today before the meeting, so I'm sure there's things that I missed. But if again, be about I'll sort of write this up. I'll figure out what each of these work groups, a little bit about what we've talked about them focusing on, and eventually we'll be reaching out to the council to ask that you all help form the work groups and find people to lead them and convene the meetings. So be thinking about that and expecting more info on that soon. And Morgan, I will pass it back to you for newsletter.
Thank you, Claire. I just wanted to ask folks if they had anything that they wanted to share with the EHE community, any events or announcements or anything that you want shared, just to forward that to me so I can include it in the June newsletter. That's all.
Thanks, Morgan. In closing, I just want to make sure everybody is reminded about the Fast Track City signing event as well as workshop. Signing event is tomorrow and the workshop is Monday. So hopefully all of you will be able to attend at least a portion of that. If you need the invite or want to pass the invite on, please let us know. We'll send that your way. Sharon, do you have your hand up? Do you have an announcement? Or
Yes, Shamar Gunn, who's one of my staff members who I want to recommend, has an announcement that he'd like to make.
Yes, we are actually having an event on June the 24th. It's the kickoff for Pride, the Pride event here in Nashville. We have a conversation series called Champagne and Conversations, and this conversation series will be called Pride, Prejudice, and Punch. So it would just be us with a panel of people from the city who has been working in the community, and they will just be speaking on different issues that we have in the community in the LGBT community and the reason why we celebrate Pride and stuff like that. So I can send you that information so you can put it in a newsletter. I'll include flyers and links as well.
thank you.
I would say it's really like a part 2 to what we did in April, and the conversation was such a great one that people were asking for more. They went back on Facebook and looked at it several times. So I'm excited about it and just so proud that my team is doing such great work. Thank you.
Sounds great, Sharon. Thank you. Sean, did you have your hand up?
Yeah, while we're announcing events, save the date for December 3rd. It's a Saturday. It's our next Ruby Gala. We had our Ruby Gala last December. We raised over $200,000 for people living with HIV in Middle Tennessee. The funds go directly toward patients of the CCC, trying to really fund and eliminate all the barriers to their care. So tons of funding going to transportation, working on dental services right now, nutrition, but also as part of a training pathway for future HIV providers, given our critical shortage. So it is our city's World AIDS Day event, if we don't have one already. World AIDS Day is 2 days before this event. So we're just getting marketing materials ready now. So you'll hear more about it, but save the date for Saturday, December 3rd.
Thank you, Sean. I think that is a fabulous heads up. So 6 months for everybody's calendar. Does anybody else have any concerns, questions, or announcements before we close out? All right. So thank you, everybody, for joining us today. Our next meeting is Thursday, August 4th, 2 to 3:30. We'll see you back here, same time, same place. Everybody have a great rest of the week. Thank you so much.
Thanks, everyone.
Thanks, guys. Bye.